25, pursuant to Standing Order 108-2, study of barriers to transition and measurable outcomes of successful transition. First, we'll have National Defence and Canadian Forces Ombudsman Gary Walburn. Ombudsman, welcome Gary, and Robin Hines, Director of General Operations. So we'll start first with 10 minutes of testimony, and then we'll swing into questions. Thank you, Gary, and the floor is yours.
Thank you, Mr. Chair, and thank you to the committee for inviting me here today. Ladies and gentlemen, I am entering the last year of my mandate, and this may well be the last time I appear before this committee to discuss transition from military to civilian life. On the subject of a seamless transition, I believe the cycle of constant review is doing more harm than good to the current and former members of the Canadian Armed Forces. This committee is currently studying the barriers to transition. The barriers are well known. Hundreds of recommendations have been made by this committee and others over the course of successive governments to fix them. Dozens of recommendations have been accepted and implemented. However, many more have not. Ladies and gentlemen of this committee, in 2010, Veterans Affairs Canada conducted a major survey on transition in concert with Statistics Canada. A related study with Statistics Canada was also done in 2012. The release of the results of another StatsCan survey of over 400 Canadian Armed Forces members and veterans and their families on the subject of transition and well-being is anticipated this month. I can guarantee you that those results will tell us exactly what we know. Enough is enough. Prior to this committee appearance, I circulated my testimony at previous committee appearances. The points I will make on transition today are the same ones I made in the reports produced by my office. I believe that much of what you are looking for has already been presented by myself and other witnesses. If at the end of my appearance here today, I have persuaded you to shift direction and focus on implementing what has already been studied, then I, indeed all of us here today, will be doing right by our transitioning members. They do not need another study into transition, and we do not need another study into transition. We just need to do it. We know what needs to be done. So what I would respectfully suggest to the members of the committee is that you take a hard look at why, after years of studies and ignored recommendations, so little has been done. Senior leadership needs to be held accountable with implementation, not tasked with more research. The recommendations that I have made to government are scarcely given credence. This includes one simple recommendation that would greatly benefit our transitioning members, authorizing the Canadian Armed Forces to determine if a member's illness or injury is attributable to service. As I have said, the Canadian Armed Forces know when, where, and how you have become ill or injured. The Canadian Armed Forces should tell Veterans Affairs Canada that this illness or injury is attributable to service and that this determination be accepted. This recommendation would decrease wait times for veteran services and benefits significantly. I made this recommendation in 2016, and Veterans Affairs Canada and the Canadian Armed Forces keep passing the hot potato back and forth, creating some very fanciful excuses as to why it cannot or should not be done. The only thing they seem to agree on is maintaining the status quo at all costs. That is a problem of bureaucracy. It serves itself. Between two parliamentary committees, both ACVA and NDDN, there have been 14 studies conducted, 190 recommendations made. The Office of the Veterans Ombudsman and my office have also made a number of recommendations. As all of you are aware, my recommendations are based in evidence. Evidence is not created, it is uncovered. True to mandate, everything our office publishes is evidence-based and factual. In order to contribute to the lasting improvements for the defence community, we take our research seriously. Evidence-based decision-making is championed across government. Political parties and senior public servants commit to its principles. However, my fear is little of what government does for its ill and injured members is measured in a way that can easily be understood. The outcomes of various programs are simply not well known. Yes, there's some tracking on turnaround times, on adjudication, and some basic operational items. However, there is no reporting on rehabilitation programming and other key indicators that any private sector benefits administrator would follow. As a result, current and former members of the Canadian Armed Forces, members of Parliament, senators, and the Canadian public have an incomplete picture of where the issues lie. To change what ails us, the bureaucratic approach and the bureaucratic systems need to fundamentally change. We need a transition process informed by evidence-based, user-centric design. It is not enough to try and fix inefficiencies here and there when the system is broken. Ladies and gentlemen, I have a 5-year appointment. I know the exact date I will vacate my office. Similarly, you as members of Parliament know roughly when you'll have to seek re-election. We do what we do because we want to make positive and lasting changes for our constituencies. Bureaucracies cannot do this for us. If you want real change, I encourage you to pressure senior leadership and hold them accountable to measurable promises. Please take a hard look at some of the evidence-based solutions that have already been suggested. Of course, there's need to be up to date on the subject of transition, and it is helpful to be aware of best practices and other solutions that may be adaptable to the Canadian Armed Forces context. However, I fear that a redundancy of studies feeds only bureaucracy. It lets senior leadership off the hook. When questioned, one can respond, we are studying it. The ill and injured continue to lose out. I, like the Veterans Ombudsman, have begun publishing report cards that reflect the status and effort that has gone into implementing accepted recommendations. It is my humble opinion that asking the government why accepted recommendations have not been implemented will bring timelier, more concrete results than doing an additional study. The current system is broken, however, it can be fixed. Please do not be an impediment to transition by standing in the way of action. The people who make up the members of the Defence Committee are important. I ask that we stop defending positions on the subject of transition that are indefensible. I now stand ready for your questions. Thank you, Mr. Chair.
Thank you. Mr. Coleman, 6 minutes.
Thank you, Chair. And thank you, Mr. Walburn, for your testimony here today. My first question has to deal with something I've heard from veterans, and I believe I've heard it from yourself and others, that it's a description of the management senior leadership of VAC as the four horsemen of the apocalypse. Could you tell me what that means to you?
I've heard that phrase in two different contexts. One, it was a reflection on the management of and inside of the Veterans Affairs Canada, and the other one, it had to do with certain policy suites. So it depends who you're talking to, but I have heard the expression, and I do believe that's what it was referring to.
Okay. And in your opinion, does it speak favorably to the way that the leadership runs affairs at VAC?
Again, these are opinions I received from members and former members of the Canadian Armed Forces. I do have to ask the question, why are we at the same place today as we were 8-10 years ago? So maybe there is a reflection. Maybe some of our policies and managerial procedures are too strict, unable to change. Okay.
On to another subject. Late last year, after the House had adjourned, this government had rolled out its Liberal pension scheme for veterans. They did so saying and maintaining that this met their commitment for lifelong pensions. What's your opinion of the program and the scheme that was rolled out?
Well, I wasn't in the room when the conversation went on about whether we're returning to a lifelong pension or the lifelong pension. I believe there were expectations on one side and promises on the other. I'm not sure if the both have aligned. As for the rollout, we ran into a bit of an issue. We wanted to run some of the scenarios ourselves because we had former members or transitioning members would like to see what their future looked like. We asked for access to the tool so that we could run some scenarios, and we were left to believe that the tool wasn't as stable as we would like, and it would considered manual manipulation before they could enter the scenarios into the system. So I don't have a full view of how this works. I know there's been multiple benefits combined and they're going to be rolled out in a different fashion. The comms on this has been absolutely horrendous. You know, I had someone ask me last week at a town hall if the new pension would impact the Canadian Forces pension. So there is much confusion in the environment. I still wouldn't be able to answer your question if it's adequate. I do believe there's been some positive movement for those most permanently incapacitated, most severely disabled, but I have no idea what the window looks like for those, say, between 25 to 70% of disability.
From the veterans advocates that I've spoken with and others who've spoken out about it, and I could read probably a dozen quotations here, it doesn't measure up to what was promised during the election campaign when the Prime Minister stood up and said, we will deliver lifelong pensions. The expectation was, clearly, that he made, was that this would return to the benefits equivalent of what existed pre-New Veterans Charter. And when you do some of the analysis, and again, I don't have time to go through some of the analysis of what benefits would be for, as you have referred to, as the more moderately medically discharged service members. It doesn't measure up, and it doesn't measure up even in the most severe cases either. It's still less than that. And my comment in asking you this is because, as you have so wonderfully articulated, the downfall with implementation and the fact that we do just repeated after repeated, looking at again what things are problematic in the transition to of a service member. This kind of scheme that was rolled out is woefully inadequate, and so my thoughts are not to go into detail, but would it be fair to characterize your comments here today as saying that although it's difficult for you to determine, it does not measure up to new Veterans Charter?
I think we can safely say dollar for dollar, it does not line up to an exact same type of financial compensation that was under the Pension Act. Again, not having access to the tool, understanding how it works, I'm kind of a bit out on a limb here making a comment on something that I haven't had a chance to review.
Okay, you made a recommendation in one of your reports that that a concierge service should be set up, and of course we've heard that the government respond to that, saying, well, the pilot project that we put together is indeed a concierge service. Now, you've looked at the pilot program, you know what's happening there. Is it the same as what you envisaged for another one of your recommendations to help veterans?
Seconds for your answer.
Okay, I can speak fast. No, when I was talking about the concierge service, I was talking about something that was to be embedded inside the Canadian Armed Forces. I think General John Vance is looking at this type of a service in the program they're calling the Journey.
Thank you. Mr. Fraser.
Thank you very much, Mr. Chair. Mr. Walborn, thank you very much for your work, and I know your term is coming to an end as the Ombudsman for the Department of National Defence, but I want to thank you for the work that you've done, and I understand and take fully what you say, and the fact that it must be frustrating to make recommendations that then don't see implementation after making those recommendations time and time again. I just want to start with the conversation you were just having regarding the rollout of the lifelong pension option. The Veterans Charter that came into effect in 2006, as I understand it, was in order to be a living tree, to be a living document that would be improved over time. It seemed that there weren't very many improvements made for a number of years, and there were additional suite of benefits that recently came into being: the education and training benefit, the caregiver benefit, and other things. Do you see these as a positive additional step, not only to the lifelong pension option, but for the well-being of medically released veterans who can then use those tools in order to regain livelihood in the workforce?
Most definitely. I think any of those programs or services that help an injured veteran move forward, for example, the caregiver benefit, that gives some relief to families, that takes some of the pressure off. So all these programs are bringing benefit without exception. And I really, just want to step back and say, there has been incremental movement over time, but when we get to the end of this, we still find ourselves talking about those slipping through the cracks. There's been good work done on both sides. I think where the Department of National Defence, the Canadian Armed Forces are headed with the Journey, I think we're well on our way to a solution. And that's why I challenge to go back and let's look at the implementation of that project. When is it going to happen? What are the milestones? How can it be tracked? Is it resourced properly? I think if we could start asking these types of questions, I think we could really start to change the game. As for the other benefits that have been brought in by Veterans Affairs, the ones you had mentioned, I think they all bring value back to the veterans community, without a doubt.
Along those lines, with retraining and vocational benefits, CISIP provides income and vocational rehabilitation after release, but vocational rehab is not mandatory as it is for in VAC. Can you comment on that and give an opinion perhaps as to whether that poses challenges to people going through the system of transition?
Well, this comes down to the core, I think, of what we're talking about. We have two entities doing a very similar job at roughly the same time, the end of career. CISIP is first payer, so their programs will come to bear first. I believe there should be a phase-in from CISIP into Veterans Affairs Canada. Why do we have one program that starts and stops, then another picks up and goes on from there? So having these dual programs running at the same time can be confusing. They can cause issues. I think the CISIP program, their performance standards are second to none. They really do a good job. So I believe there's synergies in those programs where they could be melded together to make something that is, I think there could be cost saving to the taxpayer inside of that. There could be continuity as a member transitions. Lots of opportunity there. But having dual programs run by different entities with different sets of criteria, with different rules, different application process, different entries process, you can see how this could cause a problem.
You mentioned in your comments and expressed the frustration, as I mentioned, about making recommendations and them not being implemented. You talked about D&D and Veterans Affairs seeming to play this game of kind of not taking ownership of the issue. Why do you think that the recommendations that you've made, some of them that seem very common sense, have not been implemented? And what can this committee do to see them implemented?
Well, I can't answer to why they haven't been implemented. I could, as for the second part of that question, what can the committee do? I think it goes back to, and I've said it and I'll say it again, we need to find out on a timeline when these new entities or new programs are going to be introduced. When do I need the resources? When does it happen? Who is responsible? What's the outcome I'm looking for? We need to map and measure these things because sadly what gets measured gets managed. So I think if the committee, how to help me, I mean any recommendations that are out there that have been accepted, and there have been some, I think we need to start measuring these. We need to find out, are we actually putting the resources on the ground when we said we would? And I think that would go a long way.
Can I ask one quick thing that you'd mentioned as a recommendation that seems to be a very good idea that's not been implemented, and that's CAF actually determining attribution of service and that being accepted by VAC. Have you had a response from the government on whether or not that is something that they would consider doing?
I've had a couple of responses because when we submit the report, we look for an initial response and then we'll follow up about, depending on the report, 8 to 12 months later. So I've had two responses. Both of them are different. They both have little nuances inside that are different in the response. But again, I do not have a clear, concise response as to why it cannot be implemented. I keep hearing, well, legislation would have to change. I don't think so. I think we have opportunity there that we don't have to do that. But if we do, then okay, let's do that. That's what we're all here for. So I haven't got a clear answer for you. I'm sorry, but that's where we find ourselves today.
Thank you, Mr. Walworth.
Mr. Johns, 6 minutes.
Thank you. Thank you for being here today, Mr. Walworth, Ms. Hines, for the work you do. Greatly appreciate it. Certainly, we share your frustration and that you're here again, bringing recommendations that aren't being applied. You talked to, Mr. Fraser talked about measurement of spending. What do your numbers say about how this spending has affected the veterans community so far, and what performance indicators measure the effects of spending so far that you can speak to?
Well, the only reports I see are probably the same ones everyone in this room sees, you know, when the department reports on its performance. When I speak to measurement, I want to talk about the programs that are actually helping transitioning members. Let's take vocational rehabilitation for an example. I'd like to know how many people are getting into that program, what courses of study they're following, are they having a successful completion? Once they've completed that, are they finding employment, and what type of resources are we bringing to bear there? So I do believe, you know, we measure full outputs of money at the end of the year. We spent X number of billions of dollars, but those are not the performance indicators I'm talking about. I'm talking about the day-to-day operational performance indicators that help move implementation of a recommendation forward. We see a lack of that. We see it sporadically. I think it's something that we really need to start focusing on if we're going to see real improvement here.
How's government collecting data that you see, and what could they be doing differently in how they're doing that?
Well, I think we're collecting data from multiple sources, maybe too much of it. It's how we present that data and why and how we hold it up against what our end goal was. You know, if my end goal is to make sure everyone receives a paycheck, but I'm measuring the number of windows I have in the building, they don't align. So this is what I'm finding. We talk at very high level about measurement. I'm turning over this many applications at this length of time. What's the outcome of that? Well, what is the impact of that? These are the things that we don't have visibility on. And I believe if we're going to really change things, we have to get down to that level of detail.
Super. Do you believe that there should be an independent officer of Parliament that would be overseeing and looking at that and moving that forward?
Well, that goes back to another report where the recommendation wasn't accepted. It's always been my opinion that any conversation in and around this community, I think, is of national importance. I believe if Parliament's going to dictate what the lives of serving members and veterans look like, then I believe they should have a voice at the table.
Super. My friend Mr. Coleman just started talking to you about concierge services and the importance of that. I know you only had a short moment to speak to it. Do you want to elaborate more about what's necessary there?
We submitted a report to the department called New Service Delivery Model, and inside of that there were 3 recommendations, one of which was the concierge service. Though I never got an official response back saying they accepted the recommendation, I have seen in Strong, Secure and Engaged, the defence policy. So it's been written in there, and what I understand from General John Vance, they have now mapped out the journey and what it's going to look like. I believe he is picking up on the concierge service inside of that. There will be transition services provided to every transitioning member, not just the ill or injured, but all members will receive personal service as they leave the military. I think that's exactly where we want to be. My concern, again, I'll go back to it, some of the timelines, we're looking at 2020, 2022, 2025. And this is why I say that we need to hold people accountable to what they've committed that they would do, and have measurable goals that we can review on a regular basis and question why we're either not meeting that target or we are meeting that target. I think that's where we need to go. I do believe the concierge service is going to be a big part of the journey going forward.
We know that sorry, Mr. Chair, how much time do I have?
2 minutes.
Great. We've got a lot of veterans that are falling through the cracks. I mean, there's going to be a rally on Thursday for homeless vets, those that are not getting service, and certainly appreciate the concierge service moving forward. I think it's totally necessary. You know, we believe that, you know, veteran soldiers shouldn't leave the military without services in place. What do we do to help those veterans that are falling through the cracks, that are on the streets?
Well, I think we're started down the right path, though again, another recommendation I made is to hold the member until all benefits and services from all sources are in place. Again, never received an acceptance of that recommendation, but I know that this is now, it has been talked about. I haven't seen a policy suite behind it, but the rule of thumb now is we hold a member till everything's in place. It's been said by General Vance, it's been said by the Minister. I still wait for the policy suite to come in behind that so that the commanding officers across the country have something they can hang their hat on. So we wait for that.
Okay. The Veterans Hiring Act came into effect in July 2015. Do you have numbers on how many vets have been able to access public service jobs through this act and since it came into place?
I'm sorry, I do not. We started to track the numbers over the summer. In August, the performance standards were published. I think it was about 27 or 28% of the files were being turned on time. I wrote a bit of an op-ed, and I've been ever since trying to find the numbers again. They seem to have disappeared. So I have no idea what the current performance is since about September or October of this year, last year. I have not seen the numbers published since.
Okay, thank you.
Thank you. Mr. Bertina.
Thank you. Mr. Wellborn, no one will disagree with your essential point that we keep making, having reviews and nothing gets done. When did you actually start this? Like, how many years back did you begin this process?
I became Deputy Ombudsman at Veterans Affairs Canada about 8 years ago. And I remember the first day I walked in a conversation, we were talking about a couple of things, talking about the Pension Act, but one of the words that came up in that conversation was transition. So I've been at it for about 8 years, and I know there's others who have been at it far, far longer than I. But transition has been within the top 5 issues that I've been dealing with for the last 8 years, consistent.
And your frustration is that we've identified problems and possible remedies, and then nothing gets done.
You know, to hold the member, I think, was a good recommendation. Whether it's accepted officially or not, it's good it's in there. Great step forward, but I have no policy suite behind that. There is a resource implication coming. I wonder if people understand. Holding people in situ for a period of time comes with a cost. Have we thought what that cost and how do we mitigate that going forward? So my frustration comes from, I think we have all talked about what the solutions are. I think those in the positions of command have accepted what are logic, sense, evidence-based recommendations. Now we see it's about implementation and delivery. When is it going to happen? Is it resourced? Is it been delayed? We need to know these things. So, for an example, if General Vance has decided that the journey is the way forward, then I would like to see a report card by month that takes me through to that end state so we can find out exactly where we are. I do believe the solutions to our problems exist in all the recommendations that have been made. It's coming down to an implementation. I do believe senior management is seized with these issues. Nobody is running away from them, but we seem to come at this from a very disjointed position, and we don't measure it, we don't report on it. That, I think, is a fundamental flaw.
Let me bring it right down to ground level, because I have a very recent issue in my own office with a veteran, perhaps in his 50s, who served in his 20s and is now seeking an award, a disability award, which has been turned down. And in my interview with him, I found out he wasn't aware of a MyVac account, and so we got that straightened out. He wasn't aware that there was an ombudsman. If you have a complaint that you weren't treated fairly, you can go. He wasn't aware of that. And so this awareness process seems to be, because we're getting the message out, creating this backlog that we're hearing about thousands more. Would you agree that there is greater awareness being created, and that's bringing its own kind of problem?
I do believe we've raised the level of awareness. I think there's been more talk, more publicity, more advertising around this community. So I do believe, you're right, the level of awareness is coming up. And it's going to present some challenges. I don't think I don't know if I'd call them problems, sir, but they are going to present some challenges for the department, especially if those have been away from the organization for a period of time. That time lag does cause problems. My file is probably over at archives, so it has to be retrieved. So, it can cause some delay and back problems, but I do believe the new Veterans Charter was part of the creation of the new Veterans Charter is that you can come back to it at any point in time. 30 years after you left, 40 years after you've left, if there's a malady that has a relationship to service, you can come back into the new Veterans Charter. So that's a good thing. But yeah, we're going to get some more people who have not been aware will come forward.
So in this case, which I think can be applied generally, so I don't mind talking about it, attributable to service, and you say, well, they know, why don't they just tell them? But he's saying that in his 20s, he took on a condition that has now created problems for him. He has a signed doctor's note saying that, but his application is being denied. And so if you had something like that on your desk, how would you try to deal with it?
Well, first and foremost, if the person has an illness or injury that is attributable to service, and we can do the causation between the two, they're entitled to services and benefits from Veterans Affairs Canada. There can be no question around that. Without knowing the details, I mean, this individual has a Veterans Ombudsman they can approach, but there is nothing that stops them from coming back into the system at any point in time. I suspect it's an old file. There may not be the causation between illness or injury and time served. So without the details, it'd be a little difficult. But there should, if I have a clear attribution to military service, I have an injury, then there's a clear attribution, the person is entitled to benefits and services from Veterans Affairs Canada.
Well, thanks for your work and thanks for your comments. And I know we can't argue about specific cases, but this is generally how the cases flow within our office. And so one of our problems is actually having a full understanding with our staff and so on about the programs and so on. And I think that the other problem I might suggest is that we have to look at the general healthcare system, how municipalities may be addressing questions of homelessness because they're the front line in terms of providing residential spaces, the provinces, and so on. So would you agree with me that everybody has to take on the challenge that veterans and their awards and benefits require?
You'll have to make your answer very short. I'm sorry.
Without a doubt, they're national treasure. I think we all have a role to play.
Thank you. Ms. Lambropoulos, 6 minutes.
Mr. Walburn, thank you very much for being here with us today. Every time that I hear you speak, I can see with the passion that exists, and I know that you really do want to make a positive difference for these veterans, and so thank you for everything that you do and for being here with us today. I know you mentioned several times that this study has been done and that we've not followed through with the recommendations, and obviously it's our goal to make sure that the recommendations do get implemented. I know Colin sort of touched on this as well, but I was wondering if you can tell us, because you obviously have a lot more experience than we do, where in this level of, where in bureaucracy, at what level do you think it is being stopped? Why aren't these recommendations being implemented? And do you think it's more on the DND side or on the Veterans Affairs side?
Well, I think there's blame enough to go around. I believe we both have issues inside of our own organizations that could be addressed to make this much easier. Where exactly does the problem lie? Well, I think it comes from, if we look at the current structure we have, there's 2 case managers, there's 2 nurse case managers, there's 2 vocational rehabilitation programs, there's Sisyphus First Pair, and then there's the new Veterans Charter that kicks in. So you look at the number of programs and services and the duplication, that's a major problem, and we both have a role to play there, both D&D and Veterans Affairs Canada. You know, it is what it is. I think, and how do we hold people accountable? I think the level where we need to go is at the most senior leadership. This is, you know, for my organization, if I don't perform, guess what? I own those performance standards. They're mine. I can berate my staff as much as I like. I'm going to wear it at the end of the day. That's just the way it is, in my opinion, but I believe that's where we start. People have to be responsible for what we've committed to doing. Thank you.
And you also recommended that DND transfer information about medical releases and medical conditions, especially when they're attributable to military service, to VAC. And you mentioned that this would make the process for people who are medically released a lot easier. Can you explain why and what other solutions exist, or what other changes would be necessary in order to help the process?
Right now, when excuse me, a veteran is applying for services or benefits of Veterans Affairs Canada, there's a 16-week adjudication process. So Veterans Affairs can take up to 16 weeks to just determine whether you, yes, attributable to service or not attributable to service. Their service standard is to meet that 80% of the time. The last stats I looked at in October, they were nowhere close to meeting that number. So that's how, you know, it gets measured. Careful. So we know how it gets measured. We know the 2 programs are there. So where do we go from here is the question. I'm not quite sure if I have an answer to that question. I go back to it again. I keep going back to it. We know what, where, when, and how. I want when you go to a private sector insurance company and you're hurt and you're injured and you ask for services, they want to know when, where, and how you got injured. So we know when, where, and how a soldier has become ill or injured. That's enough to release them from their career, but not enough to be accepted at Veterans Affairs Canada. That, for me, is a problem. What would happen in my world is the member would leave with their piece of paper saying this illness or injury is attributable to service that happened on such a date, and we have the evidence for that. Veterans Affairs then takes that file and just determines the level of impact of this illness or injury on the person's life. That would make a tremendous difference, I think, on the ground.
And with regards to transition in general, not necessarily just medical releases, but for any time that a veteran's released, or that a soldier ends his service or her service, can you make any recommendations as to how the transfer of information can happen in an easier way? I mean, not just when it comes to medical issues, but just in general to get support that they need when they're done with their service.
So the information flow between Veterans Affairs Canada and the Canadian Armed Forces. I think this is a fairly easy fix. I think what we need to do with our recruits when they're coming in is to have them sign off that the information that the CAF collects can be shared with Veterans Affairs Canada for the application of benefits and services, so on and so forth. So I think we can do that with our new recruits coming in. I think the situation we find ourselves in today, we're going to have to just work our way out of it as they come forward. As the gentleman was saying, people may come back 30 years later. But I think if you start the process and make it part of the tempo of what we do, I think we'll find ourselves coming out of that issue as we move forward.
Thank you. I still have time?
1 minute.
Okay. Well, I guess I'm just going to thank you once again for everything that you do, and I know that your term is coming to an end soon, but I appreciate everything that you've done till now.
Thank you. Ms. Wagenthal, 6 minutes.
Thank you, Mr. Chair. And thank you, Mr. Walborn, for being here again. I share your angst. Yes. Oh, we're in a different location. Hi. Thank you so much for being here today. And I do share your angst in regards to the fact that so many studies have been done. Being new to the House at the beginning of our term 2 years ago, my first question to this committee is, why are we restudying this? Why don't we look at what was recommended unanimously on the previous report and what is and isn't being done at this point? I would think that would be part of the role of this committee as well, to hold the powers that be to the recommendations that we've put forward to see if they are being implemented the way that they have suggested they would. You mentioned in your opening statements that senior leadership needs to be held accountable with implementation. And then when questioned, you also said, well, I can't really speak to why it's not being implemented. And on page 8 of your report, Simplifying the Service Model, Delivery Model for Medically Releasing Members, you make a statement, a willingness by the Canadian Armed Forces to state on the release message whether an injury or illness is attributable to or aggravated by service, and the Canadian Armed Forces determination be presumed by Veterans Affairs Canada to be sufficient evidence to support an application for benefits would open the door for significant improvements in the delivery of service. So the elephant in the room is the willingness side of things. Why is there a lack of willingness, it seems, and where does the buck stop on that willingness to make these changes?
Well, as I said, for my organization, I'm responsible. At the end of the day, I think it's the same for any organization. I think that's where the responsibility lies. And I don't know if it's a reluctance to implement these recommendations. I do believe they're accepted in good faith. But I wonder, if as times change, resources are pulled away and put somewhere else. If we, for some reason we go off our trail that we were on and we find ourselves not implementing the recommendation. So there's a multitude of reasons, but I'll go back to it again. If we were measuring this on a timeline of what was supposed to happen, when it was supposed to happen, we'd know very quickly if someone pulled the resources of a couple of $1 million away from an entity. We would understand quickly what the impact of that's going to be. So, I'll go back to it. We need to measure and manage.
And I mean, in the business world, same thing. You look for efficiencies and effective ways to meet your goals, which it seems our veterans are lost in all of this as to them being the true priority. You also said earlier on in your statements here that, or in your report, this reduction in processing time that would be achievable by having their illness or injury identified before they leave is achievable as the Veterans Affairs Canada adjudication would no longer have to gather evidence from both the member and the Canadian Armed Forces. Do you have any sense of what that would mean for VAC? Because when you look at how much longer it takes, because they have to do that, the number of weeks of employed people within VAC to come to those determinations when really a lot of it's predetermined at the Canadian Armed Forces level, would that impact the number of people working within that bureaucracy?
Well, first and foremost, I don't think if we have an opportunity, we should be pulling resources out of this community as it is today. I've often talked about, I've worked with Veterans Affairs Canada through the Ombudsman's office. I can honestly say without a doubt, good group of people trying to do the best they can with what they have on the ground, no doubt about it. I believe if we look at all the other issues that are inside of these transitioning members, getting to vocational rehabilitation, getting family care, getting medical care, I think that's where the focus of these employees who are not doing adjudication could be turned to look forward instead of looking backwards to find out if someone is in the club, I got an injury, yes or no. I think if you take that energy and put it forward, and let's talk about vocational rehabilitation and the follow-up and the constant concierge service, where someone would be in contact with this veteran as they transition out of the military into civilian life. So opportunity is there. I would, shudder to think that if we could save a few bucks on adjudication, we'd pull those people out of the system. I think there's enough gaps in the system.
Just to clarify, that's not where I was going with that. Really then, what I'm looking at is we struggle to have enough qualified, informed, educated case managers who really, to me, if they were where the buck stopped within VAC to make those decisions because they are educated, they know their role, they know their people they're involved with, you could have significantly more impact there if they weren't having to deal with this other side of the issue, I guess. Would that make sense to you?
Yes, I think, as I said, I think we could be future-looking, looking forward for the member. One of the big things about transitioning members, and I think others have said this, they need more hope in front of them than they have in the past. So I think, there's opportunity inside of, even these changes we're making are going to have other benefits that we haven't fully realized yet.
Mm-hmm. Okay, do I still have more time? 40 seconds? I'd like to follow up on the question of how best to use your office. The information that you provide is significant, and they could be implemented, everything that you're suggesting here. But again, it's that accountability portion of the picture and who is going to make sure that that's happening. Where do you see the best place for the Ombudsman's position to be? Right now, you're accountable to D&D, correct? Would you see a better place for that accountability to be?
Mark, please.
For the Ombudsman to report into? Right. Again, another report I released, I think this office should report to Parliament. I've said that before.
Right, thank you.
Mr. Sampson, 6 minutes.
Thank you very much, and thank you once again for your presentation. And it's always exciting to talk with you about veterans, and of course the experience you have and the knowledge around that. And then, of course, leaving in a year's time, we get the opportunity to get all the key points. But I have a couple of very important questions. The first one would be, you're making mention that the CAF should tell VAC as far as attributable to service. And that, I 100% agree with that. But if someone 10 years later develops PTSD, how would you capture those individuals?
The report that we released, we talk about those individuals. There's always going to be need for an adjudication cell at Veterans Affairs Canada because the new Veteran Charter gives us that flexibility where someone can come back 10, 15, 20, 25 years later. So there will always be the need for an adjudication cell inside of Veterans Affairs Canada, the late manifestors we call them. So that system would have to stay in place because there probably wouldn't be another vehicle for that member.
Thank you. The second one, which is extremely important, I'm not saying that we should join D&D and Veteran Affairs 100%, but what do you think of having a joint when it comes to transition? So you can have D&D and you can have VAC here or there and everywhere, but when it comes to transition, it's one department. How do you see that?
I believe there's roles for both sides here. Where I think we get in trouble is when we don't clearly define what those roles should be. Who owns the member when they're transitioning? And I think we're going to have to make some very hard decisions. I think while you're wearing the uniform, you have the responsibility of the Canadian Armed Forces. And as the client in this particular case reaching out to a service provider, Veterans Affairs, I think the Canadian Armed Forces should determine when Veterans Affairs gets engaged and on what they get engaged. I think if we had that type of a format where the client could dictate the services they wanted, I think it would work much better. I don't know if we need a third separate entity to do this. I just think we need to have clear roles and responsibilities.
Third identity, but that is the identity when you talk about transition. There is only one.
And if you look at the program that General John Vance is talking about, the journey, much of what we're talking about will be captured inside that. I do believe it's a good program, and I guarantee it'll change as we grow, but it's a good start.
You talk about no release, and again, I agree 100% with that. What do you think universality of service, is that affecting us as far as no release? Should we be looking at maybe making some flexibility around that so that we're able to ensure there is no release before everything is in place?
Again, General John Vance has spoken about this. Universality of service, I know they've set up a Tiger team and they're looking at it, which for me is very, very encouraging, because this conversation would not have taken place as little as 3 to 5 years ago. I think the Canadian Armed Forces under General John Vance have determined that there is value in these members. Just they may be ill and injured, may not be able to do everything, but they can bring value back to the organization. So, you know, there's talk around looking at easing of U of S, and I think that's a good thing. I think the assets that we can hang on to, it's going to be tremendous. Secondarily, easing of the U of S may allow those, and we always talk about the stigma that's attached to operational stress injuries and mental health. There may be an opportunity, I think, where we'd open that door a little further, where people wouldn't feel so stigmatized, or this is the end of my career if I come forward. So I think there's great possibility in that. I think it's great. I think this is a modernization piece. So I'm very pleased to see that the conversation has started.
And the other piece is the pension. Some members across the room here made reference to the pension and trying to iron out what was there before and what's there today. It's amazing, because for 10 years, a livable document did not live very much when it came to trying to answer to those ill individuals. And if we look at the pension that we brought forward and add all the ingredients, all the benefits that tie into that, that seems to be a big forward movement. I mean, there's $10 billion that's been invested in the last 2 years compared to the last 10 years. So when you put the pension, you can't just leave the pension by itself. The pension with all the extra benefits that came to support our veterans, injured veterans. Can you comment on that, please? Because the question was asked solely on the pension without talking about the real picture, the full picture.
Well, I have always said the new Veterans Charter, I think, is a modern piece of legislation. I think there's a lot of benefit inside the new Veterans Charter, access to health care and family benefits, so on and so forth. I firmly believe that. My question, and this is what keeps coming back to the desk, financially, how am I going to be compared to what I would have been under the Pension Act? There is a delta there. How big that delta is, I don't know. I can't get visibility on the tool they're using to do these projections. You know, the $10 billion has been costed, not funded. We've got it costed out for a period of years. Where do we go? I think, you know, this is going to change as we grow forward. The new Veterans Charter, the problem was always with the amount of the pain and suffering. It was always the problem with the new Veterans Charter, and then at 65 all the benefits ceased. Always the problems with the new Veterans Charter. But the new Veterans Charter is a more modern piece of legislation. It's about rehabilitation, reintegration, all those things that we talk about under modern management techniques. But I couldn't be able to tell you, and again, it keeps coming back to the comparison dollar for dollar. Unfortunately, that's where it comes back.
But you do realize that the old Veteran Charter did not have all those benefits in place.
Sorry, we're out of time. Mr. Kitchen, 5 minutes.
Thank you, Mr. Chair, and thank you, Mr. Walbom, for being here again. And I read your report last night, and I could feel the frustration in your report, and it resonated with me extremely well, because I have that same frustration. Seeing the same witnesses, hearing the same responses, and getting nothing out of this. And you were asked earlier along the questions of where do you see some of this, where these recommendations we're making, why they're not being put in place, and why are we restudying the same transition. And recommendations that we make go to the minister, and then the minister needs to respond to that, And that's where when we're talking from where it comes from the top. Can you delicately answer, do you see where it's coming from? More so directing that to do the supervisors below?
Well, ministers like ombudsmen come and go, but the bureaucracy never changes. You know, the minister has to reach down into his department, both, the civilian side of the House or the military side of the House, to get his information, to have his position, assist him in defining his position, that evidence that's given to him by the department. But again, at the end of the day, folks, what hasn't changed? That's as delicate as I can be. Thanks.
Thank you. That's what I thought. Appreciate that. Sir, under the Legacy of Care initiative, a range of service benefits for ill and injured were introduced. Some benefits appeared to only be available for the members who served in Afghanistan. The IPSU is denying benefits like child care support for seriously ill and injured because of this Afghanistan requirement. I believe the child care benefit is under Section 211.05, bracket 2. Can you look into this and report back if you can answer this right now? And will all of our operations need this?
I will have to get back to you on the specific answer, but let's just, if I may, talk about that for a second. We do that a lot. Every time there's a theater of operation or another footprint that we've assumed somewhere in the world, we'll come back and develop a program that's just for that cohort of people. And if we look at Veterans Affairs and ask why they find themselves behind the 8 ball sometimes, just look at the number of programs. There are 3 different types of soldiers in 3 different elements that get multiplied by what are, and it just goes on and on. It is so complex and convoluted. So you may be 2 veterans who serve side by side, and one may be eligible for a suite of benefits and services that the other is not. That is a possibility. That can happen. But that's for the specifics on your questions. We will get back to you, sir.
Thank you. Much.
2 minutes.
Okay, thank you. You had mentioned a little bit about data collection and the use of that data collection. And why do you see that data? I mean, we do collect a lot of data and information, but as you say, specifics such as what program is there, and that's information I think I would like to know, is what program is being offered, who's using it, how often, how successful is it? Is that set up in your research? Is that set up to be collected in along those manners, or is there something that needs to be put in place to make certain that we see that?
I think we do some measurement. I don't know how structured it is or how, on what cycle it comes. I do believe we do have to get to a structured reporting cycle where we can clearly see how recommendations are being implemented over a time. But the information we have now is the same that anyone else would receive that's published on their website.
Okay, thank you. In your report, determining service attribution, and you posed a question. This begs to question why a protracted bureaucratic process is required for VAC and the review records. And I won't read all that, but after reading that, it begged me the question as to, would you not think, would it be easier if we had VAC, as in some countries do, as an entity within CAF?
Again, I think any way we want to slice and dice this could work, but I think it's going to come down to, no matter what the entity is, who's responsible to do what on what timeline. I think this is where people slip through the cracks. This is a hand over instead of a hand off.
Thank you. Mr. Johns, we'll end with 3 minutes.
Thank you. You mentioned that you don't have the numbers of veterans that have gone into public service positions, and certainly we know return to work training is really important, and having caseworkers that understand the issues. Other countries have hired former veterans to be caseworkers for their Veterans Affairs. I think the U.S. it's 30%. Can you speak to the importance of that?
Well, I think it's to be with someone who's walked through the same life you have walked through does go a long way in helping some transitioning members. I believe there is a lot in that camaraderie, to have walked through the exact same process, I think it goes a long way. I think there's a certain level of acceptance that readily becomes available because when you get two people together like that. So I think there's opportunity inside of that, yeah.
But about decision making too, at the front line early on, is that?
Well, you know, if we put the people in the positions we're talking about, they should have the appropriate authority that goes with that position and be allowed to make the decision that needs to be made within the parameters of the policy or regulation, whatever it may be.
Right. There was an article yesterday about the government turning to a private firm to help soldiers with transition into civilian work after leaving the military. Some have expressed concern that they're unsure of what this means. Can you expand on how this might work, or any thoughts that you might have on that?
Have absolutely no visibility on it. As surprised as anyone else. Have the same concerns. I've heard, you know, we have 7,000 people currently in a program. What is to become of them? It's this type of thing. We just throw it out there without communications in behind it. So I guarantee you, Robin is my DG today, will man her phones a little heavier because it's going to start. But I think our comms on how we just dump some of these things is a little lacking. And I think this is another case of that.
D&D, you talked about the importance of health records being transferred over to VAC and that it would reduce wait times. Can you maybe speak to the 29,000 that are right now in waiting? And we've got you know, I think 48% aren't going to meet the 16-week threshold the way it's going. Can you speak to what that might look like on the number side?
The 29,000, you know, I don't know the full makeup inside the 29,000. I do know a large portion of those applications will be trying to bridge to the 75 to 90% when they've updated the ELB. They went from 75% last year to 90%. That's going to be a portion of those. But I don't know if there's actual operational files that are coming in daily in that 29,000. So I have no visibility of what the breakdown of that looks like.
You don't have any idea whether we cut it in half or, you know? Okay.
None whatsoever.
Okay. Okay, thank you.
That concludes our round today. Mr. Walburn, I'd like to thank you on behalf of the committee and like to wish you best in retirement unless you decide to come out of retirement and maybe help an MP with our cases in our offices. But the office,
A year left yet.
Yeah, the office is always open. And thank you. So we'll recess for a couple of minutes here, and then we have another panel, and we'll come back. Thanks. we have Department of National Defense. Mr. Cantalone, Director General, Canadian Forces Morale and Welfare Services, welcome back. And Colonel C.D. Harris, Director of Military Family Services.
On a point of order?
Yep, just give me a second here. We'll have 10 minutes, okay.
No disrespect to the witnesses. Thank you for being here. I wasn't here last week, but when I read my briefing notes this morning, I know that these witnesses have been already testified to this committee on this particular study. And my question to you, Chair, is why are we having repeat witnesses? And I notice another one in a subsequent meeting is scheduled to reappear on the subject matter. And can you tell me whether this was a practice that is normal to this committee, that we would have the same witnesses when we have others who have asked to be part of this program, who are not on our witness list, but are people who have made specific requests? And can you enlighten me on this?
Yeah. So the process on witnesses, it's held to the clerk, so she organizes the witnesses and puts it through. So the question, I'll have the clerk answer that for you.
Yes, the reason why Mr. Cantalone is here again is to talk about a specific issue about the family programs, and the Defense Minister suggests that Mr. Cantalone be the best representative, the best spokesperson to talk about this specific program. Last time it was on another subject.
So this is at the discretion of the Minister of D&D? Is that what you're saying?
No, I think these witnesses, and I'll see who the witnesses are, I think that was asked by probably one on the committee to ask D&D to talk about military family resources, and this is who they recommended as the subject expert from the department.
Sir, this is highly unusual for a committee to undertake a study where we bring the same officials from the same department back, because we have a chance as committee members, as you know, and it's our rights as members of Parliament to ask any specific questions outside of the single issue you just mentioned today. This committee meeting, in my opinion, is not held on that single issue today. Or are we tasked today to ask questions on that single issue, and that's why they've been asked back to report on this?
No, I don't think I would limit it, and I've ever limited a question around this table as being chair for the last 2 years. Today is about family military resources, but if you wanted to ask them another question, as long as it was on topic of the subject matter of what we're studying, I don't see there'd be an issue with that.
This study, sir, is about transition. It's not about family service matters today. We're not specifically coming here today thinking about family service matters. We're prepared to talk about all transition issues. We've had our chance with these witnesses to ask those questions, and now we're put into a position where we've got repeat witnesses, not only this day, today, but also on a subsequent day, as we've noticed on the witness list, that we're getting the same people back, that we could have asked fulsome questions, including this particular subject matter, which is what the broader study is. We're not tasked every day to a specific question. As you can tell from my comments, I'm not very pleased. And again, no disrespect to who the minister, if he's the one who said these are the people I want testifying, or the top of the top people at D&D having selected who they want to speak. But I would much rather get a broader understanding from the people inside the departments on the issues that are affecting transition in a much wider context, which I believe is what this study is.
And today we have them discussing questions on family resource centers, and we'll continue. 10 minutes, sir. Mr. Kitchen.
Similar concerns about having the same list. And again, no disrespect for the Commodore. I'm sure he can answer these questions, and he's done it quite adequately in the past. My concern, I guess, is we're doing the same thing next week with someone who couldn't answer those questions and had to continually say, defer it to giving us responses after and further along. So I just wonder why we could not have had this same presentation at the same time by one and then one by the other, instead of having them come back and forth.
Well, I guess in the sense of we had 2 hours, we had panels, and I can bring that up with the clerk the next time, that maybe we can schedule the panel as a 2-hour discussion, and it'll have more time. Mr. Coleman.
Through you to the clerk, have you exhausted all of the people on all of the witness lists from the various parties?
Not all.
You haven't. So there was options to have different people to this committee meeting today on the subject, on the general subject matter. We haven't exhausted the list. You're not at the end of the line, and you don't need to look for repeat witnesses.
I think right now.
On the
Through
list,
you, Chair.
there was a program Military for Family. It was adopted by the committee. It was one of the name.
This is about transition. It's not about specific subsets of what transition means. At least my discussions at committee and my discussions at subcommittee have never been about a subset of questions about transition. If we had known that, we might have developed a different witness list about a bunch of other issues that we'd like to see questioned. I have never recall, and can look at the transcripts to make sure, but I can never recall us discussing a subset of questions that we were going to focus on any given committee meeting. Chair, do you recall that?
I would have to have some time to think about that, but the witnesses are here. We can vote on whether we hear them today. I think that the witness list was voted on by the committee, and Family Resource Centers, I believe, has a lot to do with helping our men and women transition.
Chair, we never discussed or voted on having people come back on a repeat basis.
Well, we didn't, and I could say it to you that we did not vote not to.
Okay, that's fine. If that's the way you're interpreting it, I'll respect that.
Thank you.
But I'm going to say to you through, again, with due respect, that it would be our position.
Yes. Mr. Coleman,
could I finish, please? Yes. That our position would be that it not be a practice of this committee to have repeat witnesses come back on the same study.
Okay. Noted. Thank you. 10 minutes, please.
Good afternoon, Mr. Chairman and members of the committee, ladies and gentlemen. Bonjour, Madame et Messieurs. I want to thank you for your invitation today to offer insight about services for military and veteran families in transition. À titre de Directeur Général des Services de Bien-être et Morale.
As the Director General of Morale and Welfare Services, I am also the Managing Director of Non-Public Property and the Chief Executive Officer of the staff of the Non-Public Funds
Services Division, whose mandate is to ensure the Canadian military family community is well supported and that military families specifically are able to lead positive, nurturing lives comparable to other families, Canadian families. Joining me today is Colonel Dan Harris, the Director of Military Family Services. The Military Family Service Division is composed of regular force, reserve force, civilian non-public fund staff, and public servants. This division oversees 3 major programs that serve to address the unique aspects of military lifestyle. As the Military Family Service Program is a publicly funded program, it's delivered through a non-public property framework, and it includes funding to third-party non-profit organizations known as the Military Family Resource Centers. We also have the Children's Education Management Program, a publicly funded program that manages education with compensation and benefits of military members and dependent children. And this program includes the recent addition of guidance counseling component delivered by non-public fund staff, which has proven highly beneficial to military families as they move and transition. The Veteran Family Program is a program funded by Veterans Affairs Canada. It's executed by Canadian Forces Morale and Welfare Services through a Memorandum of Agreement. This program extends the Military Family Services program for all medically releasing members and released members and their families. The Military Family Service Program is available to families via 3 access points so that families can access the services they require in a manner that best suits their needs. First, families can visit one of 32 non-profit military family resource centres located on bases and wings across Canada. We also staff military family service points across the United States and in Europe so that families who are posted outside of Canada, or known as OUTCAN, can receive the same level of support services. The staff who work OUTCAN are employees of the staff of the non-public funds. unlike the staff at the Military Family Resource Centres in Canada, who have a voluntary board of directors and their own employer of record. Secondly, families can access our services through our 24/7 family information line. This service provides a bilingual, confidential, and referral information services to families by trained counsellors who know how to navigate the often complicated life of the Canadian Armed Forces, federal, provincial, and municipal policy infrastructures. We've also recently extended this service to now include scheduled phone or video sessions to make it easier for families to connect with our counsellors. The third access point for Military Family Service Program is through a central online source of information for military families at a website called cafconnection.ca. This is a mobile-friendly web portal that allows families to access all of the Military Family Resource Centres, as well as national information and resources relevant to all military families, and this would include veteran families in the transition program. The Canadian Armed Forces Ombudsman's report on the home front, which was released in 2013, was an important report that identified 3 aspects specific to our military lifestyle: the constant geographic relocation, the extensive absences from loved ones, and the risk inherent in the profession of arms. It is these 3 characteristics that set our serving members and their families apart from civilian families and define their needs for supports and services. The government's new strong, secure, and engaged defence policy recognizes the important sacrifices made by families and their role as a major source of strength to support the serving members. As part of Strong, Secure, and Engaged, and in the first phase of increased support to military families, $6 million per year in new funding has been authorized to modernize the Military Family Service Program and provided additional support to military families allocated to the Military Family Resource Centres and the Military Family Services. Strong, Secure, and Engage also directs a second phase of support through development of a comprehensive military family plan to augment support services and to stabilize family life for Canadian Armed Forces members and their families. The development of the comprehensive military family plan also falls within Canadian Forces Morale and Welfare Services' responsibility on behalf of Chief Military Personnel. Challenges such as establishing relocation expertise, engaging in federal, provincial, and private sector partners to improve the coordination of services across the province are some of the issues we'll be tackling in this plan. In the context of today's appearance, I'd like to touch specifically on the realities of a medically releasing member, their transition and what it means in terms of family support and the challenges faced by those families, and how the Military Family Service Program is responding. Releasing from the Canadian Armed Forces can be challenging and emotional, and becomes even more so when it's a result of a medical condition where a medical release is concerned. When a serving member leaves the Canadian Armed Forces, their family does as well. The entire family is a step away from their extended family and support structure, the Canadian Armed Forces and our service. The serving member and their family have to consider how to find those services in the area of healthcare, employment, education, and navigate in areas that they're unfamiliar to. This is why the Veteran Family Program, which began as a pilot program in November 2015 at 7 Family Resource Centre sites, was initiated for medically releasing members. As of April 1st this year, 2018, all medically releasing members of the Canadian Armed Forces and their respective families will be eligible to access the Veteran Family Program through all access points, such as the MFRC's Family Information Line and CAF Connection. There is no specific end date to their eligibility. The focus is to support on their transition to civilian services and programs. The Veteran Family Program is intended to ease the transition for the entire family and provide familiarity within a framework of services that are already well known by the military family. It's meant to provide a seamless transition of support and services at a time when medically releasing members and their families are struggling the most. Our Veterans Affairs, Military Family Services, and Military Family Resource Centre teams have been working closely together since the budget announcement of March 2017 to operationalize the nationalization of this program to ensure a seamless transition for all. Veteran Family Resource Centres, Military Family Resource Centres have hired veteran family coordinators, and joint training for new coordinators and VAC service case managers are all taking place and will be completed at the end of February to ensure an alignment of information and services. The move to nationalize the Veteran Family Program is a testament to the efforts of 7 pilot centres and the working groups who worked diligently behind the scenes to lay a solid foundation. For your information, the 7 pilot centres were in Esquimalt, Edmonton, Shiloh, North Bay, Trenton, Valcartier, and Halifax. They have been consulted extensively and have imparted their insights and learnings from the initial 2-year period. During this pilot period, from October 2015 to October 2017, there were over 11,000 interactions with medically releasing members, spouses, and family members at the pilot sites. Additionally, there were over 1,200 family information line interactions with releasing members, spouses, and family members, and another 15,500 unique page views on our CAF Connection website. Les services de bien-être moral des forces canadiennes.
We at CFMWS and Military Family Services are eager to launch the new Veteran Family Program along with our MFRC, the Family Resource Centers, and our community service partners. And we want to continue making a real difference in the lives of members, veterans, and their families. Thank you again for this opportunity to appear before you today, Mr. Chairman. I will be pleased to answer the committee's questions now. Thank you.
Start with Ms. Wagenthal.
Thank you, Chair. And first of all, thank you for being here today as you've been requested to come and to share this information with us. I do appreciate that. Again, the challenge for us is that we, as we heard from the Ombudsman as well, have studied transition issues, and we have multiple lists of what those issues are. The challenge is to determine whether or not recommendations are being implemented, and if not, why and how they are being followed up on. So with the Family Resource Centers, I was able to visit a couple, and it is very impressive. And the fact that the veterans are being included in this now, I believe, is a very good thing. The challenge to us as a committee is to try to help to discern with these resources and opportunities you're giving to them, how are you determining whether or not you are being successful? Have you predetermined what outcomes are you looking for? Do you have those that you could give them to me today? How are you planning to follow up to determine the satisfaction levels in the sense of whether or not what you're seeking to accomplish is actually being accomplished?
So at a global perspective, we do surveys. We're in the process of one right now with the Canadian Forces community, which includes veterans, family members, and serving members for all services. Specific to the military veterans program, I'm going to turn to Colonel Harris to speak to how the measured outcomes are being measured in the program, and then where we will fill in with the gaps.
Okay, thank you, sir. Yes, indeed. So when we went through the trial, so the way we've done it with the trial is communicated with the MFRCs and making sure that first and foremost we have to catch those who are ill and injured as they're moving from the Canadian Armed Forces to retirement, and they're going through their IPSC, their Integrated Personnel Support Centers, and then coming over to an MFRC. So first of all, we have to identify to make sure that we're catching all those folks that are coming through that need our assistance. So there's a huge communication plan that goes with that. Now we're in the process of determining what kinds of services they need. This is new for us, and it's new for an MFRC. It's new for the Military Family Services Program to be looking at a new population, the ill and injured population and their families, more specifically the families. So we're learning what we have to do to evaluate even what needs they have. So that's done through a very comprehensive analysis with the family as they're moving out of the military and integrating permanently into the communities that they're now going to live in, unlike the military where they're still moving around. So our whole evaluation is getting the community partners together to determine how we're going to meet their needs as we're moving along in this program.
I still have some time?
2 minutes.
Okay. I'd like your feedback on this, although it may not be directly related to this new program for veterans, but by June 2013, there had been a report done, 2012 report of the Auditor General on what was and wasn't functioning well, and the National Defence and Canadian Forces response to the fact that there were issues with the effectiveness of the programs. They said by June 2013, Canadian Forces and National Defence will review procedures to ensure that, when required or appropriate, members who are being released for medical reasons, especially reservists, successfully make the transition to Veterans Affairs Canada care. So in this case, how are you defining what you would consider success for your program with veterans and their families, obviously?
So there's two sides to the veteran experience. First part is they're in the Canadian Armed Forces. and they're a member, and that transition starts in uniform. So the first part of that is being refined for outcomes, and this is what Colonel Harris has touched on. But we're looking at an overall wellness assessment. Does the individual feel they're supported as they go through the program? The specific second part is the day they release, and now they're a veteran, and they're in the veterans program. The second part of that is in part of will be set by Veterans Affairs in terms of the specific parameters. So we have just the pilot project right now, which is what we built on. We'll run the data for about 2 years and then adjust the program to ensure we're not having any gaps. So we're in that sort of half stuck where I can't give you what the program's outcome measures will be because we're refining those as we speak with Veterans Affairs. And as soon as we'll have them, we'll publish them because they're a common standard. But there's really two sides to that. Does that help understand it?
Mr. Yolfison, 4 minutes.
Thank you, Mr. Chair. Thank you again for coming. This is something I've asked a lot of witnesses about, and Mr. Sampson actually just asked Mr. Walburn about this as well. And this is regards to, like I say, the families that you have to deal with and some of the difficulties they have transitioning, and particularly with those who are going to be medically released due to injury. We've talked a lot about the concept of universality of service, and people who might have an injury that is not catastrophic, but prevents them from serving in every capacity. Whereas, if someone lost a leg, well, of course they can't carry a rifle into combat. They can sit in an air traffic control center. And correct me if I'm wrong, I've never heard of someone who's an air traffic controller being pulled out of the tower, being given a rifle and say, carry this back out into the field. So that being said, have you heard from families the frustration that, the person doesn't want to leave the Army? There's so many things they could do in the Army or Navy or Air Force, and they could do so many of these things. But we have to leave because we have this injury. Would modifying this policy make it easier for a lot of veterans, at least transitioning or not even having to transition due to injury?
Obviously, I won't answer the air traffic controller question. I don't have the expertise. Absolutely. What you've just talked about is the family experience this as intimately as the service member, because they have, in essence, enrolled together and served together. So the families feel the same challenges as the service member, and in some cases even stronger, because it may affect spousal employment, it may affect children's education. So part of speaking to the larger part of universality of service, the Chief has been very clear that we want to come with a more flexible approach that could address exactly that type of scenario. I can tell you we have serving members in the Canadian Armed Forces who are missing parts of their limbs, who are fulfilling their daily duties right now, but they're in breach of universality of service. That is where we need to go in terms of flexible employment. The Chief's been very clear how we go there. That then would alleviate those stressors on the family, and we need to define this better, and we're in the process of doing that.
Thank you. Is there any, this is probably a very difficult question, any idea of a timeline that we might expect changes in this?
So this is where we get into an awkward sort of jurisdictional piece. It's not, it is one that the Chief wants done sooner than later. So we all know how it works. When the boss wants it done, it's going to get done sooner than later. The process is complex. To examine this, I touched, the example of medication and other items there. Can we be more flexible? There's clear science, yes, and it has to amend policies. To say, give you a date, it's not in my purview, and I think bluntly, no one could be able to give you that date at a macro level, but it is currently underway.
All right, thank you. How much time do I have, Mr. Chair?
1 minute.
1 minute, okay, thank you. I'm noticing a bit of a disconnect in policies that when CISIP is providing income and vocational, they have vocational rehabilitation, and but it's not after release, but it's not mandatory from CISIP that they're involved in vocational rehabilitation. But as part of the VAC program, it is mandatory to be part of some sort of vocational rehabilitation and training. It appears that best practice would be that early intervention and getting things going might be better. How would you suggest handling this disconnect? Might it be desirable for CISIP to start making vocational training and rehabilitation mandatory?
So I'll speak to CISIP because I can. It's my mandate. there is a very clear historical reason for why we have had approximately 90% take up on vocational rehab as so many people who would be releasing those 10%, some of those will be people who plan to retire. So from their perspective, to do a vocational rehabilitation, if I'm 53 or 50 or 47, pick an age, but I'm clearly at the latter half of my career and not 23, I may choose not to do the vocational rehabilitation, take the income support, knowing that in a few years I'll be retired and the pension will be adjusted. That's the vast majority. The second case why people do not take vocational rehabilitation under SISP is they're physiologically, for either psychosocial or their abilities, unable to do so. Important nuance is that the Veteran Rehabilitation Program for Veterans Affairs is not just vocational, it includes psychosocial and medical. So there's a way that you would obviously not do vocational, but you'd be doing medical rehabilitation that will qualify you for the Veteran Earning Loss benefit that wouldn't apply with CISA.
Thank you. Mr. Johns, 4 minutes.
Thank you. Under the Strong, Secured and Engaged Military Family Resource Centres are now receiving more funding. Can you tell me how much funding it is?
Yeah, I'll check. Mr. Harrison will be able to address that in detail.
Well, it's $6 million has gone out to the MFRCs, and I don't have the breakdown with me for the exact amounts that have gone to each of the MFRCs, but they've all applied for any of the programs that are mandated with our Government of Canada, some of the mandated programs. They've applied for additional funding, which we've already given to them this year, and will continue on in the subsequent years. But there's some of the core services that are offered by the under the Military Family Services Program are your mental health, psychoeducation, employment for spousal and family employment, special needs, healthcare, second language training, that kind of thing. So they've already come back with their input for additional funding for to enhance those programs.
So do you believe it's adequate, the money that's there right now to serve the needs?
So in regards to the program design, and it's important to understand MFRCs vary across the country in terms of services they deliver, it is filling a known gap that was identified going into the policy review, and so the application there is always more to be done, and the second part of the more to be done will be captured under the Comprehensive Military Family Plan, where we will identify other needs, and some of those needs may be better done through a national program or tailored to a local area, such as an employment thing that may be related to a provincial jurisdiction issue.
Okay, then speaking of that, does the MFS provide direction to MFRCs on how to use the spending, like directly?
Yes, the entire Military Family Resource Program is governed by orders in council as to how the money is to be allocated, and we provide guidance to them, and we do oversight on behalf of D&D and the Defence Ministers to the program being delivered for those outcomes. There are additional programs that their individual boards may choose to offer. We'll provide them advice in those cases, but not oversight.
Okay. Some OutCan families are not covered under MFS Europe. How do you contact and provide services to those families?
We actually do have military family service centers, which are operated from the staff of the non-public funds with Commodore Cantillon's other hat. So they're not under the same governance framework as the MFRCs are in Canada, but they do have outreach programs that are in for the outlying regions in Europe. So we have 3 centers in Europe itself, and then they use outreach programs to go to the other centers. Okay. Same with the United States, for example, too.
Does the MFS have any presence in provincial entities like departments of education or departments of health to help military families moving from one province to another to ease the transition?
Go ahead.
Yeah, we don't have a presence. We have a national manager who works interprovincial relationships, and we're looking to expand that capacity going forward. So we have those relationships with the provinces. There is one exception to that, which is our schools in Europe, which we run, are certified under the Ottawa-Carleton School Board, and that relationship is a formalized one with the Ottawa-Carleton School Board. So our guidance counseling service that we use operates underneath of the Ottawa-Carleton School Board, and then leveraging the network across the country.
Great. Thank you.
Mr. Fraser, 4 minutes.
Thank you, Mr. Chair. Thank you both for being here. I'm glad that you're here to discuss the Military Family Resource Centers, and obviously I think it's very important that they have now been opened up, all 32, to veterans and their families. And I represent West Nova, which has 14 Wing Greenwood, and I know the great work that the Military Family Resource Center does there on a daily basis with the entire military community, but also now with veterans. It's extremely important that family members are engaged in the process of transition. And I know that when we had retired General Romeo Dallaire before our committee on another study, he highlighted this point in an extremely impactful way to say that this is necessary and critical to ensure that those families feel like they're part of the process. And I think the Military Family Resource Centers do a great job of that outreach and engagement. I'm wondering if you can talk about, now that the MFRCs are available to all veterans and their families across the country, what level of engagement and awareness will take place to ensure that those who are eligible actually are going to come in and receive the services that will help them?
Okay, for sure. Appreciate your comments, and it is not simply, for example, just opening up the doors of the MFRC and then all of a sudden our veterans and their families can come in and take advantage of the programs that were already offered. There's fundamental differences from the Military Family Services program that we have now and the VAC-sponsored Veteran Family Program. For example, our whole program is built on the 3 unique characteristics of military lifestyle that families endure: frequent geographical relocations, extensive separation from your families, and the risk of the profession of arms, which can result in illness, injury, or death. That's what the Canadian Armed Forces their family, the programs are built to help them adjust to those living conditions as they're going across Canada. Also, a note, the difference in the programs, for an example, is that the CAF member, as you know, is looked after by the Canadian Armed Forces. All of a sudden, when you take off your uniform, you don't have that care from the Canadian Armed Forces. So under the Veteran Family Program, the veteran and the family are now included in the Veteran Family Program. So a distinct difference between the MFSP and the Veteran Family Program. But now, as you can see, this is totally turned opposite. So now a veteran and their family no longer have geographical relocations. In fact, they're permanently located into the community wherever they may live, and we don't know that at once when they're retiring. They don't have extended absences from their family, and that, of course, can have its own issues in many cases. And then thirdly, not only do they not have a risky profession anymore, they have the whole culture shock of taking off the uniform. So the Veteran Family Program is really geared to integrating a veteran and their family into the new life that they're going to be experiencing into their community permanently. So that's going to take on all kinds of community partnerships that we're going to have to educate and inform the community of what they're receiving for the ill and injured vet and their family. First of all, we have to recognize that the family has their own transition. It's not necessarily always linked to the member. We have to think about what the family, so we plan on doing that. But specifically to answer your question, we need to link up with the releasing member and their family immediately, because all ill and injured are posted to the IPSCs, the Integrated Personnel Support Centers. We need to get linked up right at that start point as soon as the member releases under the as an ill and injured member. We have to continue that process straight through with the family. We do have family liaison officers under the Military Family Services Program that are integrated into the IPSCs. So they will be able to start the comprehensive analysis of the needs of the family. The beauty of the Veteran Family Program is it's tailored for the specific needs of the family. So it's not a matter of you come in and I'll take one of these, what do you need? And we will develop a program for you to meet those needs.
Great, thank you. Mr. Bertina, 4 minutes, please.
Thanks so much. This is a really interesting topic. I'm curious about releasing members, because in my family, my sister worked her career, retired happily. Others suddenly found they were no longer able to function as military personnel, the taking off of the uniform. So at what point in the of the releasing is there an interview process which determines how the member is feeling about their situation and whether it may lead to problems? If you can understand that.
Veteran family part is what Colonel Harris has touched on. The entire goal here is to bring the family in or meet them at a location that's comfortable for them and do exactly that and talk through their needs and their expectations. Specific to the Canadian Armed Forces and the serving member, there is also a process and interviews there. And really, I'm a bit ahead of next week's witness. I've got the right week this time with General Meisner, and that's part of that as well. Is what are they trying to achieve? That's part of what they do, a holistic, what do you need in terms of rehabilitation, vocational. And prior to release, ideally, we're dealing with this in terms of can we find another activity for you to do, preferentially with an occupational transfer to a different trade in the Canadian Forces, and how would that go through? The same type of family services. So you can imagine in this case, the good news is it's not a universality of service, or we've modified that policy so it's more flexible, and let's use the air traffic controller. If you're an infanteer in Petawawa, well, it's a bad example. There is an aircraft tower in Petawawa. There's aircraft there. But I'll put you in Gagetown. There's no permanently deployed squadron, and you want to go work in Greenwood. We're going to need to transition you to Borden for training and all of that. Your family's going to need those services. So that's exactly where we would bring you in to provide those service supports through our integrated process, through the existing military family service program. So yes, there's an interview. Yes, there's one for the families. General Meisner can speak more specifically to how the Canadian Armed Forces does it for the serving member, but that's exactly the point of this program.
Is there a format or template with how these centers are designed and set up? What do they look like in Trenton or Esquimalt or so on? An office in a strip mall, or what? Just tell me what the experience is like.
Yes, there is a macro framework, which is what Colonel Harris touched on earlier in the Military Family Services Program, sets out parameters that the Family Resource Centers are to provide support. And he touched on some of those points, and that's certainly available on the web, and we can provide to the clerk further details. The actual infrastructure varies across the country. It is a public responsibility to provide the infrastructure, and so it varies from base to base based upon when they were last recapitalized. Some of those infrastructures will include such as childcare. Some of the MFRCs have branched out and also met that through community services. So it does vary. An example I'll use is Petawawa has partnered with the local school board to provide childcare services, where in Ottawa it's just done as a drop-in centre here. So it varies across.
The reason I'm asking that is I want to get a sense of the dignity of attending the centre from the released member's point of view, that it's properly done and well done in a sense that gives some reassurance.
I can personally testify to the committee that when I visit every base, I sit with the executive director of the MFRC and ideally with the chair, and we talk through these very issues. If there is a consistent theme, it is preferential for social services to be provided through the same access point as every other service, so there's no risk of stigmatization. Even though we work very hard to destigmatize that, the goal is if you have one general welcoming entrance, and then when you go into the facility, you can go off to either meeting with family services, that's the best outcome. So that is the goal everyone tries to achieve.
Thanks very much.
Chair, and thank you, Commodore and Colonel, for being here. I might add on to the air traffic controller situation, as my nephew just graduated last year as an air traffic controller in Moose Jaw, and so I'll be able to, hopefully, if he ever asks me the questions of how he may transition to other parts of Canada, where he might go, and so maybe I can at least refer to some of your comments today, so appreciate that. As I've said before, I mean, I spent my life growing up in a military family and traveled quite a bit, and although I was a base rat for many years, my dad was posted overseas many times. And so we would transition through LAR and issues when we were in Pakistan, Afghanistan, Iran, or England. We would transition. Now, LAR's not there anymore. I'm glad to hear that there's 3 places. What about other jurisdictions around the world where we deploy our soldiers as they transition out of that, it's in their last posting? For example, if someone was to take a posting in the Congo, in his last UN posting, and then would be transitioning out of that as his last post. how would they, can you walk us through how that might happen?
So I would nuance the difference between an operational deployment, such as a UN mission, so they would be deploying from a home unit, and they would be coming back to home and transition from that unit to someone posted overseas. So first of all, posting overseas has to go through a screening program, which should anyone who's got any complex issues, healthcare, child education, would not go to. So an example might be an attaché in an embassy overseas who would be at distance. They would access their release process the same as a healthy transitioning member, if I can use that, non-medically injured transitioning member, as they come back. In many cases, they will be posted back to their intended place of release. So that's that last posting, which may be back to where they were before, or maybe to a new geographic location. They'll be supported by the closest regional unit. From a family services perspective, we will support them through the national program as they identify, and through the closest regional office. So if you're in Europe or the United States, we have offices there. If you're the Canadian attaché to Chile, we'll support you through Ottawa.
And I recall, you know, back when we came back from Pakistan, and the NDHQ and the hospital was here, and MDMC was here, and so we went through that process, et cetera. And mental health issues weren't necessarily looked at as much as they are today. But as we deal with these issues today with our families, and we're looking at families now, the world is a different place. Families are different. There's a lot of issues, and divorce rates are much higher. How do we look at that aspect, and how does the military identify that situation to help as that family is transitioning? Because in the military, as we've talked about a number of times as committee, there's an attitude oftentimes where the soldier keeps that internally, does not disperse that to the spouse or to the children. And so how do they access that and make certain that they're looked after from a family point of view, especially when there's turmoil such as there might be a divorce situation occurring?
So the military family centers outside of Canada, so in Europe, for instance, in Geilenkirchen, we do have a social worker on staff to provide support. So they have access to that as well. Notwithstanding they pre-screened, but things happen in life. So it's there to provide the support. And the larger piece under this underlies the destigmatization of when you go out, ask for help. If you're having a bad day, don't say it's okay. Say I'm having some challenges, and we work together. So it's a two-edged prong. It's a culture shift, and we are providing those services to support the families outside of Canada for that specific example.
Is the information given to the spouse?
Absolutely.
Is it guaranteed that it's given to the spouse and not given to the soldier to give to the spouse?
So leaving Canada is the one place where I can say the spouse gets the brief on departing the country and services that are there. They're also met on location, either remotely by our staff through video or telephone, and provided a rundown of all those services. A little more challenging inside of Canada. We do our best to contact spouse members, family members, parents, and all of that.
Ambropoulos, 3 minutes.
So thank you for being with us today. We all know how much of an important role the family plays in the transition of members into civilian life, so thank you for your input today. There was a witness who came last week, and he mentioned that that he had a certain time frame in which he can apply for transition services, and that if a certain amount of time had gone past, he wouldn't be able to apply anymore. Obviously, not all veterans are ready to apply for these services upon retirement, and so I was wondering if, why this is the case, why this currently is the case, and if family members are allowed to not really apply for the veterans, but if they have any input and if they can strongly suggest to Veterans Affairs Canada to look into this person's file, or...
In fact, that was part of the trial. There was a 2-year limit that was put on this for the ill and injured veteran and their family to belong to the program. That's been eliminated. So under the new veteran family program, there is no timeline associated with it at all. Okay. So even if it's been 2 years and you've been out of the military, you're still welcome to come back into the program.
Yeah. Thank you very much. And another question that I had for the Veteran Family Program, as I guess Mr. Kitchen was also mentioning, to what degree are families allowed receiving these services without the veteran necessarily receiving them? If he or she is reluctant to receiving these services, how much are families allowed to receive them, and how much power do they have in this whole process?
Well, they have all the power that they want. They can come, they are more than entitled or eligible to come and use the services of the Veteran Family Program, as a family member is right now a current serving member with the Military Family Services Program. So as that transitions over, they have the same. So sometimes maybe a member will be isolated from them. The family is still welcome and still can contribute to the Veteran Family Program.
I would add to that, there's no geographic restriction on that. So family is not just spouse. Parents, niece, nephew, if you're related to a serving member and you want to contact one of our MFRCs, feel free to do so. They will reach out, or the Military Family Program or the Family Information Line.
Okay, thank you. And last question, if I have time. All right, so how do you guys reach out to these families if they don't necessarily know about the program?
So this is multifaceted. We have a closed Facebook community that we talk to. We use email. We use all the media relations that we can come up with. So inside of this Veteran Family Program, for instance, under the Canadian Forces Morale and Welfare Program, we have a Canadian Forces Appreciation Program. We'll use that list to mail out. We have about 100,000 veterans in that. Veterans Affairs is contacting all their known veterans. We are dealing with publicity in the local area and good old-fashioned word of mouth. So it is multifaceted to try and reach out so people are aware.
Thank you.
That's it.
Great, thank you. And I'd like to thank both of you for taking time out of your busy schedule to testify today. We'll need to recess and clear the room very quickly. We have an in-camera issue we'd like to deal with. So we'll adjourn for 2 minutes. Whoever's not supposed to be in the room, if they could exit, be appreciated. So recess.